Hello, everybody. Welcome to Anatomy and Physiology online class. And today we continue covering joints. We will cover anatomy of selected synovial joints. This video lecture on joints, I already recorded the first part when we discussed classification of different joints, their structure, right, where they found, and so on. So this is our first video. The second video, we will only talk about some selected joints, their structure and function. So let's go ahead and begin. So the first joint is zygapophyseal joint, and this is a joint between a vertebra and specifically between superior and articular processes of two adjacent vertebrae. So here's superior vertebra, this is inferior vertebra. Now this bony part is called superior articulating process, and this one is inferior articulating process. So the joint between them is zygapophyseal joint. I'm sorry. Right there. Zygapophyseal joint. We have other joints between vertebrae, like over here we have intervertebral disc, for example, but this is not synovial joint. That's why we are concentrating on those joints only. Now in the cervical and lumbar region, we have greatest range of movement. In the neck, this joint allows for flexion, extension, lateral flexion, and rotation of your vertebral column. In the thoracic region, you can see we have same movement, flexion, extension, lateral flexion, but those are movement more limited compared to neck region. But at the same time, in the thoracic region, you have greatest rotation of the vertebral column. Lumbar region, same movement, extension, flexion, lateral flexion, and almost no rotation. So it's largely prohibited. Also have a joint between atlas and axis, and it's called Atlanta-axial joint that allow for rotation. So it's a pivot joint. You have den of the axis and is allow to rotate your head. Atlanta-occipital joint is between occipital condyles of the occipital condyles of the occipital bone, yes, and the C1, right? So this is our first cervical vertebrae. This is C1, and it's articulate with occipital bone with occipital condyle. So this one is Atlanta occipital joint, and Atlanta axial joint is between C1 and C2. Right, so both are synovial joints. TM joint or temporomandibular joint is articulation between condyle of the mandible, that is right here, and a mandibular fossa of temporal bone, that is right here. So also synovial joint, we have articular capsule, we have articular cartilage here, that's a disc. So here's articular cartilage, we have synovial fluid. This joint allow depression and elevation of the mandibles. So you move mandible up and down, protraction, anterior movement, retraction, posterior movement, and it's give you gliding and hinge motion. So you remember that most of the bones of your skull are connected by sutures. Sutures are thin arthrosis. So they're not movable joints. The only movable joint of your skull is TM, temporomandibular joint. Shoulder joint is glenohumeral joint. If you remember, we have a scapula, and within scapula, we have glenoid cavity that is a socket, and humerus has a head, and head of the humerus is a ball. So it's a ball and a socket joint, largest range of motion of any joint in the body. And because we have large range of motion, we're losing stability. This is how it works. More movable joint, less stability. Now, to keep this joint in place, we have capsule. The capsule, like any synovial joint has a capsule. This capsule is formed by tendons of 4 muscles. And those 4 muscles are supraspinatus, infraspinatus, teres minor, and subscapularis. So if you look at the next picture over here, let me show you where those muscles are located. So this bone is scapula. So we're looking at posterior view of the scapula. Now this bony structure of the scapula is called spine. We have fossa above the spine, and this will be our supraspinatus muscle. Below the spine will be infraspinatus muscle. And this is anterior view of the scapula, so muscle located here will be subscapularis. All right, so let's go back. So now these muscles form a capsule. They're tendons, I'm sorry, form a capsule. And mnemonic to remember is SITS, S-I-T-S, right? So here we have supraspinatus, infraspinatus, teres minor, and subscapularis. All of them insert on the head of the humerus. So they all insert into a head of the humerus and forming this cuff around the head. That's called rotator cuff. Also, you can see other structures here, like we have glenoid cavity, right? We have articular cartilage, we have a bursa. So all the structures are common and found within synovial joints. So other ligaments that we need to know that support shoulder joints shown on those pictures. And name of those ligaments are correlated to the name of bony processes of scapula and another bones that they connect, clavicle or humerus. So here's what I mean. I already told you that this is spine of the scapula. Now this process of the spine, right, of the scapula is called acromion. So this is acromion, right? So here's acromion. And this process of the scapula is coracoid process. So that's a coracoid. Now this is clavicle. Now look how we name those ligaments. We have caraca clavicular ligament. We have caraca acromial ligament, and we have acromia clavicular ligament. So when you name a ligament, you start with a less movable bone. Like for example, here is going to be coracoid process. It's not a bone, it's a landmark of a bone. So you start with less movable part, coracoid, and then the second part of the name will be more movable bone. So caraca clavicula, caraca acromial, acromia clavicula. Now over here you have a glenoid cavity, remember, of the scapula. So this is glenohumeral ligament because it connects this glenoid cavity to humerus. And we have anterior glenohumeral, we have posterior glenohumeral and superior glenohumeral ligaments. This structure over here is a tendon. Tendons connect muscles to bones, and this is a tendon of bicep brachii muscle. So very quick recap, we have several ligaments that you guys need to know: coraca clavicula, coraca acromial, acromia clavicula, glenohumeral, and of course anterior, posterior, and superior glenohumeral ligaments. Elbow joint. In the elbow joint, we actually have several bones that connected to each other. But the connection between humerus and ulna, this is what, really elbow joint is. So it's a humera-ulnar joint. And it's a joint between trochlea of the humerus. So this part shows the trochlea and trochlea notch of ulna. This is a hinge joint that allow movement in one plane, allow for flexion and extension of your elbow. Of course, we have several ligaments over here, intrinsic ligaments. We will look at them on the next slide. But we also have in your elbow, we not only have flexion and extension, but we have rotation as well, medial and lateral rotation, and we have pronation and supination of your hand. And that movement is allowed because of the joint between radius and ulna. We have proximal radial ulnar joint and distal radial ulnar joint. And those are pivot joints that allow those rotations that I just mentioned. So we have a joint between humerus and ulna, and we have joints between ulna and radius. Now, those intrinsic ligaments, they prevent side-to-side movements and hyperextension of your elbow. Now let's look at the ligaments and again make sense of their names. So by the way, this is trochlea of a humerus, and over here is a trochlea notch of ulna that forms this hinge joint. Now the ligaments on the ulna side is called ulna collateral ligament, and collateral means same side. So that's ulna collateral. So it's on the same side as ulna. And this one is radial collateral ligament. So it's on the side of radius. So that's pretty much what we have, right? So ulna collateral and radial collateral. And we have annual ligament of radius. And annual means it round, it goes around, so it goes around the radius and connects radius and ulna, and this is the one that allow us rotation, annual ligament of radius. So again, ulna collateral, radial collateral, and radial collateral kind of the fibers fuse with annual ligament of radius. Go back, yeah. Hip joint. Hip joint is a multi-axial joint. It's also ball and a socket joint, and head of the femur articulates with acetabulum. So if you remember, acetabulum is a socket found in a hip bone, in os coxa bone, and the femur would have this round structure that is called head of femur. It's a stable joint with a wide range of motion. And of course, we have several ligaments. Let's look at those ligaments on the next slide. So just want to remind you that this bone is your hip bone or os coxa bone, and it's made of 3 bones fused together. So this is ilium. This bone over here is ischium or ischium, that's ischial spine over here. And this bone over here is your pubis. So here we have the names for our ligaments: iliofemoral ligament, puba femoral ligament, and ischiofemoral ligament, right? And acetabulum labrum is fibrocartilage that goes around acetabulum. Knee joint, probably one of the most complicated joints that we cover in this lecture. 3 articulation, femoro-patella joint, and medial tibia femoral and lateral tibia femoral. So that you can see the tibia articulates with the femur. That's why it's tibia femoral. And if you remember that tibia, it has a lateral condyle and medial condyle, and femur has a lateral condyle and medial condyle. So we have this articulation between condyles of the femur and tibia. So that's a hinge joint, allow for flexion and extension and some rotation when leg is flexed. So we have some other structures here that we need to talk about. We have articular discs that are called meniscus. So meniscus is C-shaped cartilage, right? So it's right there. And it's found on the medial side and lateral side. So anterior is over here. So that's why this is the lateral side. So that's a lateral meniscus, and this is medial meniscus. And we have ligaments. Now, we have more than 4 ligaments, but these 4 important ligaments have similar names. So we call them CL, 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 and then you're gonna add the directional term, like lateral, medial, anterior, posterior. Now this L, the last L stands for ligament, the C stands for collateral or cruciate. So it's actually names are different, but when we abbreviate, it's the same: LCL, MCL, ACL, PCL. So fibula collateral ligament, you already know it should be on the same side as fibula, right? So, and fibula is a lateral, so it's a lateral collateral right here. Medial collateral or tibial collateral on the medial side, medial collateral. Now, cruciate ligaments are intrinsic ligaments, right? So this is our anterior cruciate ligament over here, and this is posterior cruciate ligament. So we will see those ligaments better on the next slide. So here our femur, right? So that's a femur, that's a tibia. So we have tibia femoral joint, and we have lateral collateral ligament, medial collateral ligament. And here's the posterior view. You see a lateral cruciate ligament that has like 2 arms. Oh, I'm sorry, lateral. Posterior cruciate ligament has 2 arms, and anterior cruciate ligament over here. Now, we cannot see cruciate ligaments from anterior view because they covered by a tendon of quadriceps muscles. So here's a tendon of quadriceps, and inside this tendon, we have patella, right? So the patella bone will be right there. So that will be patella bone. And then this tendon extends into patella ligament and it attaches to this area that is tibial tuberosity. You can also see lateral meniscus and medial meniscus. Now, another thing to pay attention to, this medial collateral ligament has some fibers that fuse with medial meniscus and with anterior cruciate ligament. So we have three structures that really have interlacing fibers. Those three structures are medial collateral, MCL, medial meniscus, and anterior cruciate ligament. And it's important for understanding knee injuries that we will see in a second. But here, before we get to the next slide, you can look at anterior view of a knee joint, and here our anterior cruciate ligament and posterior cruciate ligament. So this is our lateral collateral. Over there, right there is medial collateral. This is lateral C-shaped meniscus. This is medial meniscus. This is patella ligament and tendon of quadricep muscles. And here's the patella right there inside. So now when I told you that anterior cruciate ligament, medial meniscus, and medial collateral ligament, the fibers kind of, there's some connection between those fibers. That's why when we have, let's say, some damage to the knee, and usually it happens from a lateral side, right? So we have direction of force from the lateral side of extended knee. That means your knee is in anatomical position. That will lead to the rupture of three structures. So anterior cruciate ligament, the medial collateral ligament, and medial meniscus. All these three structures can be damaged. That's what is called terrible triad. Ankle and foot joint. So we have talocrural joint, and this is a joint between talus. So here's the talus, and here's the tibia. So it's between talus and tibia. Anterior part of the tibia is called crura. That's why it's talocrural joint. So that's our ankle joint. Allow for dorsiflexion and plantar flexion of your foot. So dorsiflexion, we would move this way. Plantar flexion, we would move this way. But you not only can flex and extend your foot, you can also have some degree of rotation. It's called inversion and eversion. So inversion, when you kind of, rotate your foot towards the midline, and eversion, you rotate it away from midline. And this is due to subtalar joint. Subtalar joint is this joint right here, and it's between talus and calcaneus. So that's calcaneus, this is a talus. We have several ligaments, like over here, we have deltoid ligaments. We have anterior talofibular ligament. So because this is a talus and this is fibula, so that's a talofibular ligament. We have posterior and anterior tibia fibula ligaments. So again, tibia, fibula. Thanks goodness, at least in the name of all these ligaments, we just use name of bones of their landmarks, or calcanea fibula ligament. So if you don't remember a name, at least when you see the name, you know what bones are connected by that ligament. Right? So ligaments support ankle and resist excess inversion. How joints are formed? The joint forms together with the bones that they connect. So we know that bones can be formed by intramembranous or endochondral ossification, and everything starts with mesenchyme cells. So joints form in conjunction with associated bones. For limb joints, limbs are formed by endochondral ossification. So over here, if you see human at 1 month old, 1 month already a human, right? So here, this part is still cartilage. This part is still cartilage. And then when this cartilage ossifies, all right, through the endochondral ossification, the joint form as well. So we have synovial joint formation. Cells undergo death to form the synovial cavity. We also have some cartilage left in epiphyseal plate and also articular cartilage. And then this epiphyseal plate with age ossifies, became epiphyseal line. So the point is that joints form in a conjunction with associated bones. Common joint injuries include sprains. And sprains when we have ligaments that are stretched or torn. So we have stretched or torn within collagen fibers because ligaments are dense regular connective tissue. So here's a normal ligament, here's grade 1 sprain, then we have small tears. The tears became larger, so it's a grade 2. And if you have complete tear through the collagen fiber, that's a grade 3 sprain. And if you have small tears, they will repair themselves. If you have complete rupture, then this injury will require surgical repair. Then we have cartilage tears. So not only ligaments can tear, the cartilage can tear as well. So shown here the meniscus. Usually it's due to compression or shear stress. Fragments, like you see this fragment or this fragment of the cartilage, they can lock the joint and reduce the mobility. Cartilage rarely repairs itself because it's a vascular tissue, so it will require surgery. Dislocation or luxation and subluxation, it's actually when the joint is forced out of its alignment. So either we have complete dislocation or partial dislocation of a joint. So shown here, that's a healthy joint. This is subluxated and this one dislocated. And dislocation very often accompanied by sprains, inflammation, and joint immobilization. Usually because of serious falls or playing sports. So that was our dislocation or luxation and subluxation. Bursitis is inflammation of bursa. So just to remind you that bursa is a structure found within synovial joint, and it's like a pocket filled with synovial fluid. And see here, it's inflamed. So usually by friction or a blow, and treated by rest, ice, and if severe anti-inflammatory drugs. So you can see here it's pretty bad bursitis. Now, itis means inflammation. So now tendonitis is also inflammation, but that's inflammation of tendon. So we don't have tears, we don't have luxation or subluxation. We pretty much have tendon that is inflamed, usually because of overuse, and symptoms and treatments similar to bursitis. So rest, ice, and anti-inflammatory drugs if needed. Arthritis. Now, arthritis is an umbrella term for more than 100 different types of inflammatory or degenerative diseases that damage joints. So iris is inflammation and arth means joint. So it's inflammation of joint. It's the most widespread disease in US. Symptoms include pain, stiffness, swelling. It can be acute forms caused by bacteria, for example, then we will treat it with antibiotics, or it can be chronic forms. And chronic forms include osteoarthritis, rheumatoid arthritis, and Gouty arthritis. So let's look at these three different arthritis in a little bit more details. So first you can see normal hand over here and rheumatoid and osteoarthritis. You immediately can probably notice that rheumatoid is more severe damage of joints. Now, osteoarthritis is common, irreversible, degenerative arthritis. It's called wear and tear arthritis, and it's believed to be related to the normal aging process. About 85% of all Americans will develop OA, osteoarthritis, at some point of their life, usually in a late life, because it's wear and tear. More common in women than men. More cartilage is destroyed than replaced in a badly aligned or overworked joints. And bones became exposed and they became thick and large, form bone spurs and restrict movement. So you hear these nodes of the bones here, and you see that, we don't have normal alignment between bones anymore because of the damage of joints. Now, rheumatoid arthritis shown here in the late stage. By the way, this is osteoarthritis in the late stage as well. Looks almost like okay, right? Taking in consideration it's an older person, but this is really messed up. So that's our next one, rheumatoid arthritis. Now, this is autoimmune disease of unknown case. Now, your immune system attacks your own joints. It's a chronic, it's inflammatory. It develops a little bit earlier than osteoarthritis at age 40 and 50, but may occur at any age. And again, more common in women than men. Symptoms include pain, swelling, usually bilateral, means both extremities are involved, anemia, osteoporosis, muscle weakness, cardiovascular problem. So you can see these changes within a joint cause deviation, like radial deviation of the wrist or ulnar deviation of the fingers, dorsal subluxation of ulnar head. So that's autoimmune disease. And here, progression of rheumatoid arthritis, what you can notice over here, that space within joint became narrow. So we have narrowing of the space between bones, right? And over here, say, look, we don't have space at all. So that's our terminal rheumatoid arthritis. And we start looking at the bone erosion, subluxation, right? So lots of changes happen, pretty devastating changes with rheumatoid arthritis. And Gouty arthritis, caused by deposition of uric acid crystals in joints and soft tissue, followed by inflammation. This one more common in men. It typically affects the joint at the base of the great toe, so right there. Right, so you can see it's here and here, right? If it's undertreated, the bone ends fuse and immobilize the joint. Treatment includes drugs, plenty of water, avoidance of alcohol. So that's our last slide. So let's do a very quick review. what we covered within this lecture. So we were looking at anatomy of selected synovial joints, and we started with the articulation in the vertebral column, temporomandibular joint, shoulder joint, elbow joint, hip joint, our complicated knee joint, also ankle and foot joint. We mentioned the joint formed in conjunction with associated bones, and we look at common injuries of joints like sprains, cartilage tears, right? So luxation, subluxation, bursitis, tendonitis, and arthritis. We said that it can be acute form or chronic, and chronic include osteoarthritis, that is degenerative disease, wear and tear, rheumatoid, that is inflammatory autoimmune disease, and Gouty arthritis, inflammatory arthritis as well, caused by deposition of uric acid. Okay, so that's it for this lecture. Thank you for watching, and I hope it was helpful.